Welcome to the ANEW Insight Podcast, empowering and inspiring your journey to optimal health. Hosted by Dr. Supatra Tovar, clinical psychologist, registered dietitian, fitness expert, and author of Deprogram Diet Culture. Rethink your relationship with food, heal your mind, and live a diet-free life. I follow my guests' journey to optimal health, providing you with the keys to unlock your own wellness path. Tune in and evolve with us. Hello, everyone. I am so thrilled and honored to have esteemed trauma psychologist and multi-channel eye movement integration expert with us today, Dr. Maria Gear Haugen, otherwise known as Dr. H, with us today. Dr. H, hi.
So happy to see you.
So happy to see you too. I'm so
Yes.
excited to interview Dr. H. I met her at the American Psychological Association conference in my home state of Colorado earlier in August, and was so impressed by this new type of therapy called MEMI, or Multichannel Eye Movement Integration Therapy. And so I really wanted to have her come on board so that we can learn more about her and about this really interesting therapy for trauma. So before we get into our questions, I'm going to read just a little bit about Dr. H, and then we will dive right in. Dr. Maria Gear Haugen, known by many as Dr. H, is a trauma psychologist with a unique background in spanning mental health research, consulting, and clinical care. She has dedicated her career to helping trauma survivors find healing and resilience. After successful work in consulting and earning her MBA from Columbia University, she shifted her focus to psychology, earning her PhD with a specialization in trauma and spirituality. Dr. H has served veterans with PTSD at the VA, worked with children and adults facing trauma, and developed innovative healing approaches, including multi-channel eye movement integration, or MEMI. Today, she trains providers and works directly with clients to help them recover from adversity with compassion and clarity. Dr. H, welcome.
Thank you. Wonderful to be here.
Well, it's wonderful to have you and to have somebody with such a really unique and interesting history. And that's how I usually like to start off my podcast, is really understanding people's inspiration to do what they do. So you have had quite a fascinating career. It started in research and consulting before it turned fully towards psychology. Can you just share a little bit about that journey and what led you to focus on trauma?
You know, it really has been a journey, and in a way, it's been a circle because I did start with psychology as an undergrad. I was a double major in psychology and theology, and so those threads are moving through my life. And after I did research for a while, I got really interested in data analytics
Mm.
and focused on that for a while, which, along with organizational change that I was interested in, leadership styles, I decided to transition pretty early in my career and get that MBA at Columbia. It was a focus on internal systems and nonprofit and public management, which was, in a way, a consistent thread into mental health, I thought at the time. And so I did that consulting for many years in Washington, D.C., and in the New York City area. And I remember to this day a moment when I was walking down in D.C. somewhere, and I was about to start my own consulting firm, which entailed hiring employees and setting up a structure. And I thought, gosh, is this what I want my legacy to be? And I thought, that's an important question. And I really then dedicated 2 years of my life to discerning the answer to that question, and it really led me back to, my first loves, which was psychology and, trauma specifically.
Mm.
I had
Well, what
had a
about trauma
Yeah,
exactly
yeah,
drew
good
you toward it?
question. So I had a dear uncle who was a very spiritual man as a child growing up. He was my sister's brother. and he was a priest, and he was, very involved in people's lives, and by extension, I was involved in, people would come to him with tragedies and heartbreaks and all kinds of suffering and pain and trauma, and I often would be called on to help out, go to someone's house or go with him to such and such a place. And I think I really learned compassion and respect and attention to people who are suffering, people who are not at the best points in their life and yet deserve respect and compassion and care. And I really think that thread kind of pulled me uh, to trauma.
How beautiful. I love when our own family, especially, inspires us to do incredible work. And I do think that
Yeah.
many psychologists are inspired either in a negative or a positive way by their
Hmm.
families
Hmm.
to help others recover from similar things or from the things that we're most interested in. So, at what point did you realize that working directly with people in clinical settings was the legacy? Was it that moment, or were there some successive experiences that really solidified your path?
Well, it's an evolution. We all are an evolution, aren't we? Um,
Mhm.
I was very interested in research, and I really thought that would be my path. All of my academic research was in trauma. Some of it was also in spirituality and how that's affected by traumatic events. And I really thought that was what I would continue to do until I did my clinical internship at a VA, at a PTSD clinic. And I thought, wow, this is a way to really apply all of that knowledge that I've gained from my research into really affecting people's lives. And that, I think, is really what switched it for me.
Well, can you give me a picture of that? I mean, we have, I think, a good idea of what veterans have gone through, but were there any particular cases that really stood out for you that made you want to continue in this work?
This was back in the day. So we really didn't have, certainly didn't have cognitive processing therapy. PE really was not used much. It was in the very early days. And so we didn't have a lot of tools besides empathy, listening with attention, caring for people, and I think an earnest desire to help them in their difficulties of their life. But it was really that, perhaps it was the fact that I found that people were able to be helped just through those simple tools, and move on with their life. I worked with people with dual diagnoses, either substance abuse or traumatic brain injury. And so, those are some real challenging times that people were trying to get through and coming to us for help. So it really was that sense of, I can do something here, and I've seen people be helped by this.
I think that's so wonderful. And just for listeners who don't know what PE is, it's a prolonged
Ah,
exposure.
yes.
And so that's a common and very effective trauma treatment, although there's many more. And we're going to be talking about MEMI soon as well. But it really does testify to the fact that oftentimes healing is the most about the relationship between the caregiver and the
Mhm,
and the client, and so
mhm.
that I think is really apparent in your history in working at the VA before these more concentrated and validated treatments. So I think that's so wonderful. But what were some of the key lessons that you learned in early work with trauma survivors, like children, adults, veterans, that shape how you practice today?
I think your questions are so insightful and profound.
Oh, thank you.
They really help me, focus in on some, I think, key questions in my own development as a provider and someone who, I view my work as being a witness for people, helping them through difficult times in their life. And I really think that the echoes of parts of my practice that I find to be enduring and important really come from those early experiences. So, that attunement to the person that's in front of me is so important. It's not just the words, it's the posture, it's the language, it's the voice, the cadence, what they're not saying, that I think is very important. Compassion, non judgment, acceptance, and really respecting and yet empowering people because I know they're resourceful.
Mm.
Events have blocked those in many cases inside for people to really feel that they have resources to help them heal, but I really view my work as being a facilitator and, uh, almost walking with them in a way rather than guiding them or directing them. I have some tools, but they do the work, and I really respect that.
Oh, me too. I
Yeah.
really resonate with what you just said. I think attunement probably is the most, well, let's say attunement, compassion, and empathy.
Mhm.
And I would add mindfulness, I think,
Yeah.
are the most important characteristics a therapist can embody because it's not as effective if we guide, or obviously it's not effective if we tell them what to do.
Mhm.
But
Mhm.
when we're there and we're walking, through their experience with them, maybe adding some tools along the way, but just listening and just being there is so therapeutic, so helpful. When somebody can actually finally feel seen, I
Yeah.
think that that's when true transformation begins to happen, and that is such a beautiful thing. So, yes, absolutely.
And,
Did you wanna add something?
well, you even think about regular interactions that we have. How often are we truly aware that someone is being fully mindful with you in any given moment? There's such power in that. And I do practice very much being present and being with the person. And that in and of itself is very powerful. It's validating to people. I'm important. I'm worth someone paying attention to me, which, as we know from PTSD, is not a feeling that's often there.
Yes, and I think it's a rare quality, especially with the advent of smartphones and social media. I think
Yeah,
people are often just distracted and not fully listening. So
yeah,
when we actually do that, it's quite pleasantly alarming to have somebody
it's
mindfully attuning to you. And that's why I love podcasting too. I
mm,
just love having these kind of conversations. I love looking in my guests' eyes and seeing their emotion and really following along with their journey and their story. So to me, it's very similar to therapy, but on a highly intellectual level. I think more
yes,
than
yes.
therapeutic level. Um, so before we dive into MEMI, I am so interested in this, and we're actually going to spend the majority of the second half of this podcast on MEMI. I
Okay.
just want to hear about your experience with traditional evidence based therapies for trauma. What do you find helpful and what do you find limiting? We just mentioned cognitive processing. We've also mentioned prolonged exposure. But if you could help listeners who don't really understand the kind of different types of trauma therapies out there, give us just kind of an overview of your thoughts about them and their effectiveness.
Well, this is in my experience. As I say, I started with an exposure based therapy, which basically means that the person is coming to you about an event, normally what we call capital T traumatic, and it's disrupting their life. It's getting in the way of relationships, of work, of things like sleep, and even going out in public or attending family functions. And so there's always some level of dysfunction in people's lives, and no one wants to operate with that. And so they come to someone to help them get through that. And so with an exposure therapy, And I've done prolonged exposure and narrative exposure and written exposure therapies, but the general principle is you talk through the details of the event, or you write about the details of event in the case of written exposure therapy, and you do it repeatedly. And the idea behind this kind of therapy is that the exposure itself, the exposure in your mind to this event on a repeated basis kind of habituates us to the effects of that event. And so our symptoms go down. That's the idea with an exposure therapy. There's also a more cognitively based therapy called cognitive processing therapy, which I've used very many times. That's based on the idea that thoughts are that we have about events. So have some kind of trauma in my life, and because of that, I believe I'm weak, or I'm no good, or I'm not worthy of good things, or I should have done this, that, or the other. And the belief there is the theory behind that is that those beliefs really get embedded in our minds. And of course, what we think affects how we feel, what we think affects what we do. And so they really see in that triangle of thoughts, beliefs, and action, or emotions and actions, that thoughts are central. And so the focus is on changing those thoughts to be more reality based and more balanced. And I have had people and with children, I really did play therapy,
Mm.
which continues to this day. But my practice has pretty much gone in the direction of adults. And so my experience is that for some people, they're really effective. If they're able to be pretty verbal, everyone's not. To be able to talk about the details in great detail about your trauma, everyone's not able to do that. The dropout rates for those are very high, exposure rates are very high. There continues to be research indicating this, as well as for CPT, because the time commitment, if you're paying for it, the cost, it's anywhere from, 12 to 15 sessions. And so that can be prohibitive for people as well. And so, although I saw many benefits for some people, I also saw people who dropped out. I saw people who would start and then get frightened. This is too much for me. They just couldn't manage the reactions that they were having. And so, I certainly continue to offer those options to people, but I've found over time that the number of people that we can help with those approaches is really limiting. There are
Mm.
just too many people who aren't able to either tolerate it, afford it, or even avail themselves of those kind of therapies.
Wow. Yeah. They
Mhm.
they certainly are limiting, and I'll throw into the mix. It's more of a narrative therapy, but it can be whatever it wants to be. Trauma focused CBTs, something that you
Mhm.
do often with children.
Yep.
They either like pick a narrative that they want to write, or they can like create art, or a poem,
Mhm.
and it's based off of exposure. So it they are more lengthy, and they are, I think, more limiting in terms of, being cost effective for certain people,
Mhm.
um, and I think for those who aren't as verbal or aren't as aware even of their
Right.
emotions,
Yep.
it's very difficult. So then tell me a little bit about MEMI, and I know it seems like it has a connection with EMDR. Do you is there a connection with that? Is it an offshoot of EMDR? Give me a picture of how it might be different, and if you could illuminate for our listeners exactly what EMDR is, that would be really helpful for people because I know that's something that they're very interested in.
So, MEMI is an eye movement therapy. There are a number of them that have developed really since the 70s and 80s. So they've been around for a while. The most widely known is EMDR. And I really view MEMI as an evolution in eye movement therapies. It is much more straightforward. I know EMDR practitioners sometimes, don't actually use all of the steps because it's a bit cumbersome. Um, and it can take some time again. And so with MEMI, we're using more of the visual field. So all of the other eye movement therapies deal with this kind of movement. Actually, with EMDR, it's right at your eye level.
Right to
Same
left.
with brain spotting. You're going back and forth like this. Well, there's research that indicates that the brain functions according to different parts of the visual field. And this research goes back close to 50 years that indicates things like when I think of something in the future visually, my eyes tend to go up and to the right. When I tend to recall something from my past, a visual, it tends to go up to the left. In fact, you probably hear the FBI watches people's eyes to understand if they're lying or not. And so this is not new research, but the application of it as it deals with trauma with MEMI is new. So we use the entire visual field, which helps the brain. It disrupts the pattern of the brain because we're disrupting the normal eye pattern that we would use as you're recalling an event. And by doing that, it really changes some structures in the brain and calms the limbic system, which is what causes a lot of the symptoms of PTSD.
Wow, that is, I think, probably the most simple and understandable explanation that I've had for these eye movement therapies. And
Mhm.
explain exactly how MEMI is different. I mean, EMDR, you're saying the movement is usually right to left. MEMI's using all of the visual field. What about
Mhm.
brain spotting? If you could explain for people who don't know what brain spotting is, how is that different from brain spotting?
Brain spotting, again, the idea is that and I'm not a provider in brain spotting, but I certainly know about it. You're looking for as a provider, one of the things that you're doing with MEMI is you're watching people's reaction as they're following your finger. I actually use a green pen because I think green is positive, and so I
Mm.
might use this green pen. And remember, with MEMI, and this is different also, it's sensory based. And so we're not asking them for the details of the event. They don't need to say a word about what it is. Often I don't have any idea what it is that we're working on. That doesn't really disrupt the effectiveness of it at all. But I do ask them for sensory elements of it. So when you think of it visually, is it in color or black and white? Is
Mhm.
it fuzzy or clear? Is it a still photo or is it a movie? And so we
Mhm.
get set elements of that, and then I'll ask them, are there sounds connected to this event? Is it loud or soft? Is it words or sounds? Is it close or far away? And then I also ask for visceral elements. So physically, what do you feel in your body when you think about this event? And where is it located? What's the intensity of it? Does it throb? Is it sharp? So we're trying to get a sense of the visceral feelings. And then, of course, we ask for their visceral emotional feelings. So, what
Mm.
emotions are connected to it? So, those are all sensory and a little bit of somatic elements that we're asking them. And then in the session, I'm asking them to cast it on the wall behind me.
Mm.
They're casting this vision, the sounds, the way they feel in their body, the emotions connected to it over here, which is a way to help people separate themselves from the trauma itself.
Wow.
Therapeutically dissociating through space, it's over there. And so while they're looking at that, I'm doing an eye movement. And so they're kind of splitting their attention, keeping that in their mind at the same time that they're doing whatever the eye movements are. And through the course of the process, we measure change by first assessing at your baseline. So when you think about that, when you see that vision of this event, how intense is it? From 0, no intensity, 1, 2, 3, 4 is the very highest intensity. How disturbing is it for you? We assess the same for the sounds, for the physical sensations, for the emotions, and so that's our baseline. That's where we start. And then as we do each eye movement set, which each has different parts of the visual field that we're accessing, I'll say after we go through a set, has anything changed? How has it changed, and is it for the better or worse? And then I also ask them, okay, when you think about that, when you see the visual now up there, how intense is it from 0 to 4? People move their numbers in terms of how distressing, how upsetting each of those sensory elements are. That's what determines how you're progressing in MEMI. And that's actually what determines when they're finished.
Fascinating.
It
And you
really
had
is.
mentioned that, CPT and prolonged exposure take a significant amount of time. I remember you mentioning during your session that MEMI can be a short-term therapy. How short
Mhm.
can it be?
It can be one session.
Oh, this is so amazing, you guys. You can
You
resolve
know,
your trauma in one
yeah,
session.
yeah, it's
One.
it's 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 hard to believe until you experience it and you see people, actually doing it. I'm in consultation now with, someone new to MEMI, and she's just she emailed me right after her first session and said, "Wow, I can't believe this," and this is someone who's been doing EMDR from the very beginning.
Wow. This is
Yeah.
so fascinating. Well, listen, I have more questions. We didn't get to one of these, and I'm going to start off the next section with that question. But you guys, this is really amazing information for trauma treatment. And I'm really hoping that you come back for the second half of this amazing interview with trauma psychologist and multi channel eye movement integration or MEMI expert. Dr. H. Dr. H, will you come back in just a second with me?
Happy to do so.
Okay, we'll see you again, you guys. Thanks for tuning into the ANEW Insight Podcast. Please remember the contents shared on this podcast is for entertainment purposes only and does not constitute medical advice. You can find us anywhere podcasts are streaming, on YouTube at my.anew.insight and at anew-insight.com under the ANEW Insight Podcast tab. And follow us on our socials at my.anew.insight on Facebook, Instagram, TikTok, and Threads for more updates. Tune in next time and evolve with us.